What motivated you to become a sonographer?
Well, at first I had no idea what I wanted to do. But I had the question raised of what about, any allied health careers. And so I just did some investigation online and looking at the different allied health, such as X-ray, nuclear medicine, CT, MRI, and ultrasound was one of those. And it just seemed like a fun career, something that would be challenging, yet rewarding. And being that I wanted to work with kids, I did find my niche in working with children. So originally wanted to be a teacher, and so I think I really enjoyed doing ultrasound.
Mm-hmm. What steps did you take to get here?
So I started working in an adult facility. That's the thing, when you graduate, you really have to make your decision what to specialize in. You have so many different areas in ultrasound that you can specialize in. You can work in the vascular clinic, OBGYN, you can work in pediatrics, or you can even work in a women's center doing mostly breast ultrasounds and OB. So just depending on what you are interested in, you just go from there, and you just apply. And for me, I was proactive in finding a job. I would actually call and ask to speak to someone and all that. So once you finish your clinicals, you're done with that. But you also have to take your state board examination. It's not a state board, it's just your regular boards. You have to become certified in the ARDMS registries, and they have different requirements for those. So once you complete those, you have to also get your CME requirements every 3 years to stay updated.
The pros and cons of your job?
Let's see. Pros, it's definitely rewarding. You're helping people, and you help diagnose certain things. Ultrasound is more than just taking pictures. It's more than just the anatomy. You're asking the patient questions about their clinical history. You're getting to know the parents. You're talking to the patient. And so it's a lot more than just taking pictures, because you're applying that to what you're looking for in a certain exam. So it's kind of like an investigation where you're trying to find something going on with the patient that matches their symptoms. So you really feel like you're helping them, and you do find things that otherwise, wouldn't be found, or, that can help the patient. So you're helping people. It's very rewarding. Some of the challenges, especially in pediatrics, is, sometimes you have patients, from the 1 to 2 age range that are very challenging. They're scared, and the parents are nervous. So that's probably the most challenging thing about my job. But we have child life specialists that actually help during the exams, and we have toys and things that we do. We play with the kids to get our images. So there's nothing that can't be,
So there's nothing you just hate about this job?
Not really.
Anything you would change?
No, not really. I really love what I do.
That's awesome.
Yeah.
What advice do you have for me?
My advice to you would just be, if you are interested in ultrasound, whatever classes you are taking now, just focus on, your anatomy and physiology. Try to go ahead and get that as a backbone, and know your anatomy well, because that will help you in all of your classes. Because some of the things that you learn can be challenging when you start learning the cross-sectional anatomy. You're learning things in cross-section, and you're getting used to looking at it as a slice, like on a CT, a CAT scan, and it's a little different to get used to. But once you have that knowledge base, everything else will come naturally, and you have your physics and everything else. Just work hard at what you do, and just whatever you set your mind to, you'll be fine. So